Let's talk about your pelvic floor muscles, a hidden but vital part of your core. Picture them as a supportive hammock stretching from your pubic bone to your tailbone, holding up your bladder, uterus, if you have one, and rectum. These muscles control bladder and bowel movements and play a big role in sexual function. Kegel exercises, named after Dr. Arnold Kegel, are simple squeezes that strengthen this muscle group. For women, Kegels help during pregnancy, after childbirth, and can prevent organ prolapse. For men, they support bladder control and sexual health, especially after prostate surgery. Weak pelvic floor muscles can cause leaks, heaviness, and reduced sexual satisfaction. Regular Kegels counteract weakening from aging, childbirth, surgery, or being overweight. Think of Kegels as essential maintenance for your core. Simple, discreet, and effective. Kegels are a go-to for many women, often recommended as a simple solution for pelvic floor health. They're widely known and easy to do almost anywhere, which makes them seem like a no-brainer for anyone experiencing issues like bladder leaks or pelvic discomfort. Especially for stress incontinence or after childbirth, Kegels are often the first exercise suggested by doctors, friends, and even online resources. Many women are told that strengthening the pelvic floor is the key to regaining control and confidence. These exercises work by strengthening the muscles that keep the urethra closed and support the pelvic organs, helping to prevent leaks and improve core stability. When done correctly, Kegels can be a powerful tool for recovery and long-term health. But Kegels aren't for everyone. If your pelvic floor is too tight, a condition called hypertonic pelvic floor, doing more squeezing can actually make things worse instead of better. It's a common misconception that more exercise is always the answer. Signs of a tight pelvic floor include pelvic pain, pain during sex, frequent urination, or constipation. You might also notice discomfort when sitting or a feeling of heaviness in the pelvic area. These symptoms can be confusing and are sometimes mistaken for weakness, when in fact the muscles are overactive. If you have these symptoms, it's important to see a pelvic floor specialist before starting Kegels. A professional can assess your unique situation and help you find the right approach, whether that's strengthening, relaxing, or a combination of both. Sometimes, relaxation and stretching, not strengthening, are what you need. Learning to let go of tension in the pelvic floor can be just as important as building strength, especially if your muscles are already working overtime. Kegels aren't a universal fix. For some, learning to relax the pelvic floor is key. Techniques like mindful breathing, gentle stretching, and body awareness can help restore balance and comfort. Reverse Kegels, which focus on releasing tension rather than contracting, can be just as important as traditional Kegels. These exercises teach you to lengthen and relax the pelvic muscles, which is crucial for some women's health and well-being. Listen to your body. If Kegels cause pain, discomfort, or make your symptoms worse, stop immediately and seek professional advice. Ignoring pain can lead to further complications and delay your recovery. The right approach depends on your unique pelvic floor needs. Every woman's body is different, so working with a specialist can help you find the safest and most effective path to pelvic health. First, let's talk about how to find your pelvic floor muscles. The easiest way is to try stopping your urine stream mid-flow while you're in the bathroom. This action uses the exact muscles you'll be working during Kegel exercises. It's important to do this just once, only to identify the right muscles. Don't make a habit of stopping your urine, as it can lead to other issues. Once you've located your pelvic floor muscles, you're ready to start practicing Kegels. The great thing is, you can do these exercises almost anywhere, at your desk, in your car, or even while relaxing at home. No one will even know you're doing them. To begin, find a comfortable position. You can sit or lie down, whichever feels best for you. Make sure your bladder is empty before you start, as this helps prevent any discomfort. Take a moment to relax your body. Let your shoulders drop, unclench your jaw, and take a few deep, calming breaths. This helps you focus on the right muscles and avoid unnecessary tension. Now gently squeeze and lift your pelvic floor muscles, as if you're trying to stop the flow of urine or prevent passing gas. Hold this contraction for 3 to 5 seconds. You should feel a gentle lift inside your pelvis. Be careful not to tighten your stomach, thighs, or buttocks. The goal is to isolate just the pelvic floor muscles. You can place a hand on your abdomen to make sure it stays relaxed. After holding the squeeze, fully relax your muscles for the same amount of time, 3 to 5 seconds. This relaxation phase is just as important as the contraction. Both the tightening and the relaxing help your muscles grow stronger and more flexible. Don't rush, move slowly and with control. Start with 10 repetitions in a row and aim to do this set 3 times a day. You might find it helpful to track your progress in a notebook or with a phone app. As your muscles get stronger, gradually increase the length of each hold up to 10 seconds, and add more repetitions if you feel comfortable. Progress at your own pace. There's no rush. Remember, it's normal to feel a little tired or even frustrated at first. Building muscle takes time, so be patient with yourself and stay consistent. Always breathe normally throughout the exercise. Never hold your breath, as this can create unnecessary tension and make the exercise less effective. Over time, you'll notice improvements in your pelvic strength and control. You might even see benefits in your posture, core stability, and overall confidence. Focus on doing each repetition with good form. Quality is much more important than quantity. Doing a few well-controlled Kegels is better than many rushed ones. Make Kegels a regular part of your daily routine, perhaps during your morning coffee while watching TV or before bed. With dedication, you'll see lasting results and improved pelvic health. Once you've nailed the basics, it's time to take your pelvic floor training to the next level by focusing on perfect form and mindful movement. This means paying close attention to how your body feels during each repetition and making sure you're truly isolating the right muscles. Only your pelvic floor should be working. Your abs, glutes, and thighs should stay relaxed and at ease. This isolation is key for building strength where you need it most. If you notice tension creeping into your abs or glutes, don't worry. Simply pause, reset your posture, and try again. It's normal to need a few attempts to get it right, especially when you're just starting out. Now let's introduce the reverse Kegel, a powerful complement to the standard Kegel exercise. Instead of squeezing and lifting, the reverse Kegel is all about consciously relaxing and lengthening the pelvic floor muscles, allowing them to gently release and expand. To practice, inhale deeply and let your belly expand outward, feeling your breath move all the way down to your pelvis. As you breathe in, imagine your pelvic floor gently dropping or melting downward, like the bottom of a balloon expanding as it fills with air. Practicing both Kegels and reverse Kegels helps you develop balanced, functional muscles, strong enough to support you, yet flexible enough to move with you. Alternate between a squeeze, Kegel, and a release, reverse Kegel, for a well-rounded routine that trains both strength and relaxation. This dynamic approach is especially helpful for managing tension and improving control. The best part? You can integrate these exercises seamlessly into your daily life. No special equipment or gym time required. Try them at your desk while standing in line at the store, or even as you relax on the couch watching TV. Consistency is key, and these exercises are designed to fit into your routine, no matter how busy you are. For extra relaxation, pair reverse Kegels with deep, mindful breathing. This combination not only calms your pelvic floor, but also helps reduce overall stress and tension in your body. A balanced pelvic floor is both strong and flexible, supporting your posture, core stability, and even your confidence in daily movement. With regular practice, you'll notice improvements in your overall health, energy, and sense of well-being. Both types of exercises, Kegels and reverse Kegels, are essential for optimal pelvic function, helping to prevent issues like incontinence, pain, or weakness. Make them a regular part of your self-care routine and give your pelvic floor the attention it deserves for lifelong health. Pelvic floor strength directly impacts sexual satisfaction for both women and men. For women, Kegels can increase sensation, control, and orgasm intensity. Try rhythmic contractions during sex, long squeezes, or quick pulses to enhance pleasure for you and your partner. Communicate and experiment to discover what feels best. Reverse Kegels are crucial if you experience pain during sex. Relaxing the pelvic floor can make penetration more comfortable. Deep breathing and conscious relaxation before and during sex can reduce tension and anxiety. For men, Kegels help with erection quality and ejaculation control. The pelvic floor is an active participant in sex. Learn to contract and relax these muscles for better intimacy. Connect your mind and body for greater sexual satisfaction. You have the power to improve your sex life with these simple exercises. How soon will you notice results from Kegels? It varies. Most people see improvements in 3 to 6 weeks if they practice consistently and correctly. You might notice less leaking or better sexual function within a month or two. If your muscles are very weak, it could take 3 to 6 months for significant change. Don't get discouraged. Think of Kegels as a long-term investment in your health. Make them a daily habit. Sporadic effort won't deliver results. Aim for 3 sets of 10 to 15 reps per day. Once you reach your goal, maintain your gains with regular practice. Use it or lose it. Keep your pelvic floor strong for life. Stress incontinence, leaking urine when you cough, sneeze, or exercise, is often due to weak pelvic floor muscles. Kegels strengthen these muscles, helping you regain control and confidence. Research shows consistent pelvic floor training can significantly reduce or eliminate leaks. Practice the knack. Squeeze your pelvic floor just before and during activities that trigger leaks, like sneezing. Over time, your muscles will react automatically, protecting you from accidents. Kegels are a first-line, non-surgical solution for stress incontinence. With practice, you can laugh, jump, and live without worry. Take back control with this simple, effective exercise. Kegels are important, but your pelvic floor is part of a bigger core system. Strengthen your core with diaphragmatic breathing. Inhale to lengthen. Exhale to gently lift the pelvic floor. Coordinate Kegels with your breath for better results. Add core exercises like bridges, planks, and bird dog to support pelvic health. Maintain good posture. Sitting and standing tall helps your pelvic floor work efficiently. Pilates and yoga are great for building deep core strength and awareness. Integrate pelvic floor engagement into your workouts for maximum benefit. A strong, aligned core supports a healthy pelvic floor from the inside out. Kegels are powerful for men too, supporting urinary control and sexual function. Strong pelvic floor muscles help manage premature ejaculation and improve erection quality. The bulbocavernosus muscle, part of the pelvic floor, controls ejaculation and helps maintain erections. Practice Kegels to gain conscious control. Squeeze to delay orgasm or maintain a gentle contraction during sex. With practice, you'll be able to use these muscles on command. Strong pelvic floor muscles can lead to harder erections and more intense orgasms. Kegels also help trap blood in the penis, boosting erection quality. Start by mastering Kegels outside the bedroom, then use them during sex for better control. Just a few minutes a day can transform your sexual confidence and satisfaction. Invest in your pelvic health for long-term benefits. It's a simple routine with powerful results.